welcome back to episode 7 of the Physiology and Philosophy podcast. Today's guest is another very special one to me. It is my current advisor, Dr. Carlos Ugrinowitsch. And I may be a little biased because he's my advisor, but I think he's one of the staples in the exercise science field. And as he mentions, over the past 30 years of doing research, he's published over 275 peer-reviewed articles, and his work has been cited over 13,000 times. So the numbers speak for themselves. And a lot of the work that I've done with him is more in the sport performance space. But more recently, through interacting with him and some of his students, I've been aware of some of his work investigating more of the therapeutic and clinical potentials of exercise science. And more specifically, some of his work on exercise and its ability to reduce the motor impairments of Parkinson's disease. It's a very moving topic and it's very powerful, and as I mentioned in our chat, I'm very glad that someone of his caliber and the field as a whole is starting to really apply exercise science in more of these therapeutic aspects. So today's conversation is all about exercise and all of its modalities for reducing the motor impairments of individuals with Parkinson's disease. We keep things very topical and it's brief. We only talk for about 37 minutes, I believe, here. And I hope to have him on again where we dive into maybe some of its exercises' impacts on individuals with more motor and cognitive impairments, but also other lighter subjects such as sport performance as well. I really enjoyed this conversation and I hope you guys do as well. All right, we are live. I am joined by Dr. Carlos Ugrinowitsch. Carlos, thank you for joining me today. How are you doing?
Thank you for having me.
How's everything going by you this morning?
Fine, good. Have done a lot of things up to like here. It's in Brazil. It's 10 o'clock, so it's a busy morning, but it's okay. I'm ready to. As a matter of fact, I'm looking forward for our interaction.
Me too. For those who maybe aren't familiar with you or your work, could you give us sort of a brief background on some of your research interests?
Okay, so I am an exercise scientist with 30 years of experience in the field. I also work for 10 years as a strength and conditioning coach in elite volleyball teams. And my research interests are neuromuscular adaptations to strength training, sports performance analysis. What else? Oh, effects of exercise with non-communicable diseases or chronic diseases. I'd say that those are the most important ones.
Obviously, in the introduction, I will explain our relationship in a little more detail. But since I've known you, most of the work that we've done together has been in the sports performance space, either looking at ways to enhance on-court performance, hence my dissertation, and also just previous resistance training interventions to sort of optimize different outcomes like hypertrophy and strength. But over the past several years through our Zoom meetings, you started to fill me in on some of your projects looking at the effects of exercise on neurodegenerative diseases and Parkinson's. And it just felt very powerful to me to know that someone with an exercise science background could have potentially such a profound impact on what I consider to be, real problems in the world, where these are people who really need help. And I'm glad to know that people like you are trying to help them. So I was hoping for today we could mainly just cover some of your research looking at the effects of exercise on the motor symptoms and impairments of Parkinson's. Is that okay with you?
Yeah, of course. That's perfect.
I figured just to start, if you could describe what Parkinson's disease is, and as well as the prevalence of it as well. I think that could be a good foundation.
Okay. So Parkinson's is a neurodegenerative disease that has a higher prevalence in individuals above 65 years of age. Nowadays, we have around 8 million people in the world with Parkinson's disease. And each year, around a million more are diagnosed or have the diagnosis of Parkinson's disease. Okay, and basically it's degeneration in the area of the brain that produces dopamine, and the absence of dopamine in our bodies produce several motors and non-motor symptoms that greatly affect the quality of life and daily life activities of the individuals.
Wow. So, just to summarize to see if I'm interpreting it, it's a lack of our brain's ability to adequately produce and uptake dopamine, which has a downstream
Exactly.
effect impairing. Is it both cognitive and physical abilities, or is it mainly motor?
At the later stages of the disease, yes, we do have cognitive impairment.
But mainly in the beginning, it's mostly expressed through these motor impairments. Is that correct?
Exactly. Well, yes, but we also have non-motor symptoms related, such as like decrease in sleep quality, control of autonomic nervous system, of the other bodily functions, such as increasing heart rate as you exercise, perception of the exercise load. So different symptoms. Okay.
Um, that makes sense. I think
And the
dopamine
major,
is.
let me just clarify one thing. The major motor symptoms are tremor. So everybody knows this symptom. But we also have impairments in balance, and we have uh, a decrease in body movement. So our ability to move fast also decrease. So it greatly impairs our ability to basically function in a day. So yeah.
And what's the current standard of care for someone with Parkinson's disease? What are there any? I'm sure there has to be some FDA approved medicines, but currently, what's the guidelines if someone was freshly diagnosed?
Yeah. So usually for the diagnostic of Parkinson's disease, they give you levodopa, and levodopa it's a medicine that increases dopamine in the brain, and then if the motor symptoms decrease with this medicine, then basically it's a confirmation that you have Parkinson's disease. So we have several medicines that could be given to the patients. I don't want to address this point because that's more of a medical issue. It's outside my field of expertise. But what is very interesting is that in the most recent recommendations for individuals with Parkinson's disease, you know, they have said they stated that exercise it's a first line treatment. So you should be able to maintain or to decrease the progression of the disease, if you exercise in a daily basis after the diagnostics. So
Wow.
it's pretty cool stuff. Yeah, exercise it's a very powerful tool. If you just kind of realize that the American College of Sports Medicine, it's one of the major exercise prescription societies in the world, and they say that in their recommendations. That's really good news, and that's
Wow.
even better for the patients because medications they have several side effects, that are kind of bad for the patients, and the effects of the medication seem to decrease over time. So a former doctor student of mine, she had a personal patient, her client, that she's a physician and she has Parkinson's disease. And she was able to completely remove the medicine just doing exercise
Wow.
because
That's
her symptoms improved. Yeah, her symptoms improved so much, and that's one of the lines that is my former student is kind of working on. So this is great news.
it seems like there is a shift in the industry where for a while it felt like most treatments came in the form of medications. And I think as exercise scientists, you obviously have a much greater historical perspective on this than me. there was some underlying awareness that exercise and a proper diet could potentially have, the similar effects with, minimizing the downside. So it also feels like there's an awareness that exercises are being treated not only as a preventative measure, but, looked at as a, diet or
A treatment per se.
a treatment.
A treatment per se.
And
Yes.
what are the
So that's really okay. Go ahead.
I was just going to ask you the mechanisms behind it, but feel free to go wherever you're going to go.
Yeah. So let me, before getting to the mechanism, let me give you sort of a perspective on how, you know, exercise or physical therapy have dealt with this disease for the last, I'd say, 20 years. So basically, as these individuals, these patients, they have a high incidence of falls, and accidents at home and all this stuff. So exercise scientists and physical therapists, they have been kind of concerned of exposing these patients to more demanding exercise. So they say, okay, just walk and do some resistance training. But previous research has shown that this kind of very simple activities, they may help, but not as much as more, I would say, within quotations, more aggressive exercise. So going to this direction, our research group kind of developed a new training method to, instead of doing very safe and low complex motor complex exercise, we realized that Parkinson patients, they had to be exposed, or they need to have like a high motor demand to respond. And the mechanism for this proposal was based on two aspects. First, so if our brain is not a static structure as we have thought before, so this is kind of a common knowledge in the literature. So our brain, it's very plastic, so it can change, can modify. So basically, we can grow new neurons in our brain, or new synapses, new connections between these neurons as our body is stressed, and we can pose then like a cognitive stress or like a physical stress. Another problem, as this disease is more prevalent in individuals over 65 years of age, at this age, their cardiovascular system has kind of presenting an important decline. So less blood, it's going to your brain. And the less blood you have on your brain, the more what we call like oxidative stress you have in your brain. The more you have of this oxidative stress, the higher your mitochondria, or the greater the dysfunction of your mitochondria. It's kind of a feedback loop, positive feedback loop. So the more oxidative stress you have, the less your mitochondria is going to work, the more oxidative stress you're going to work. So it's just like this cycle. And the less ability, and when you lower the ability to produce energy for your neurons, you're going to have to start seeing like an important brain decline in cognitive function, or even in volume, in several aspects of your brain. So if you improve your cardiovascular function, you're going to be able to send more blood to your brain, and then you can preserve or decrease the decline of the mitochondrial dysfunction and what we name like brain atrophy. So you start decreasing the volume of your brain. So is that good so far? Do you want to kind of summarize something or add something to that?
The only thing that I want to ask you is the sort of the rationale you just provided of improving your cardiovascular fitness, providing you with more blood flow to the brain. Is that a general recommendation, even for people in this age category who don't have Parkinson's disease?
Yes.
Is that it's something? Okay.
Yes.
And then is
Yes,
that
as a
why?
matter of fact, As a matter of
Yeah.
fact, we just published a study showing that the VO2 max, so the ability that the individuals have to absorb and utilize oxygen, is directly related to the rate of, well, it's really not directly, but it's related to the degree of brain atrophy. So individuals with higher levels of physical activity, as they age, they tend to preserve the brain volume, and brain volume is a very important index of cognitive function. So individuals with dementia, they have a very high degree of brain atrophy. Okay,
Yeah. So maintaining
so
cardiovascular fitness for this aging population is something that can just improve health span and quality of life, irrespective of if you are diagnosed with Parkinson's disease or not.
exactly, exactly, and then so this is one way to kind of preserve your brain structures, and there is another way to kind of as far as we know, not to preserve, but kind of stimulate neuroplasticity. And there are some reports in the literature showing that the higher the motor complex of the exercise that you perform, so that requires attention, motor coordination, and things like that, the more neuroplasticity you can have. So basically, you can kind of reshape your brain doing very complex exercise. So basically, what we did, we developed or we implemented existing training program to Parkinson patients, not very severe. So it's the middle stage of the disease,
Mhm.
stage 2 and 3. And when we implement this exercise with motor complex, so they showed a kind of a very important improvement in the motor signs, the debilitating motor signs that we just talked a few minutes ago. And this exercise programs encompass two things, so force production, because individuals with Parkinson's disease, because of the drop in the dopamine, they cannot produce a lot of muscle force. So we combine strength exercise with uh, instability. So basically, it's like this: in the point that your force is supported, so it's the point that you are applying force to move your body in any direction. We just put a stability device, so like a Bosu or a Dynadisc. So individuals, instead of producing force in a very stable condition, they were like this, producing force. So they need to improve the motor control, balance, and they had to kind of demand from their bodies a higher degree of motor control, and they had to be really concentrated to the exercise. So after this training protocols, we showed like a wide variety of improvements in motor science and functional tests and more neuromuscular assessments or indices.
And is there a
Okay.
traditional scale that the severity of Parkinson's disease is measured on?
Yeah, it's a scale from 1 to 5, and 5 is the most severe stages, and 1 is the most like mild stage.
And
So
this program,
for this study, we
you,
go ahead.
you finish. No, you finish.
Yeah, and this program we developed for individuals at stage 2 and 3.
And how much? So this program that encompasses both force production and instability training. What's the magnitude of effect that this training can offer on this scale that Parkinson's disease is measured on, or is that not
Yeah,
the right way to look?
I would say that that's not the right way to put it, because I think that now it's clear that each individual responds differently to the
Mhm.
exercise training, but in theory, or on average, they can improve like 15-20%. So that those are kind of good numbers for that.
Got it. And to just take a step back, one step further, the program you specifically just mentioned was, again, force and instability training. Have you looked at just endurance training on its own and resistance training on its own? Have each of these both been proven to be effective, or is there sort of an ideal training that comprises both of them?
Uh-huh. So, as I said, so improving VO2, so VO2 max is directly related to brain volume, blood flow to the brain. So endurance exercise, it's widely recommended for this population. So it's just like a very important exercise mode for these patients. And the other is this high motor demand exercise. So ideally, patients should uh, have a program developing endurance and this high motor complex exercise. So that would be an actual recommendation. The problem with this is that in the literature, we haven't found like a training protocol that encompasses these two training modes compared to like only strength training and only endurance training.
Got it. And is there a set protocol or somewhere we could find the prescription of how much endurance training someone with Parkinson's disease could benefit from? Is that well defined? Are these sort of the frequency and the duration?
I'd say that there isn't like a clear protocol, to improve VO2 max on this population. But overall, training at high intensity, it's better, and regardless of the method. So, and we know that the higher the frequency and the higher the intensity, the more improvements they will present. So I would say that and the standard protocol is just like 3 times a week, 2 times a week at the highest intensity possible, But people need to understand that the highest intensity possible for individual with Parkinson's disease, it's not like sprinting, it's just an intensity that they can, support or maintain for a period of time, and while they have good exercise or motor coordination, you know,
Got
because
it.
sometimes they are
And
cycling and they kind of decrease the frequency of the pedaling because they cannot maintain. So if they can maintain a high intensity for like exercise for 2 or 3 times a week, that's great. That's good for them.
and obviously in your
And,
research,
let me add one point here. So this, of course, it's anecdotal data, but in our experience, uh, patients seem to benefit if they exercise every day.
okay,
Okay, because if you, especially in the earlier stage, if you want to kind of see the effect of exercise, you need to exercise as much as possible.
okay. So
Okay.
as much as possible, and obviously in your controlled research studies, the patients come to you or the clinic that you're working with. Is it recommended that every exercise session that is performed by an individual with Parkinson's disease is at a specified clinic? And do these places exist, or is it something that they could do at home on their own? What's how careful do you have to be?
Well, yeah, okay, that's a very good question, Jake. A very good question. The problem is this: whenever you expose the patients to high complex exercise, so I'm talking about like the strength and motor coordination exercise, you always need someone supervising you, because they
Mhm.
can lose their balance, they can fall, so they need direct supervision. So it's not advised to perform by themselves at home.
Okay.
That's a very, very important recommendation.
Yeah.
Okay.
Um, and
And
so,
as far as I know, uh, there is no, see, the individuals listening to this podcast, um, need to kind of consider that I am in Brazil and I don't know what is it's actually occurring in clinics in other countries like in US, Europe, and so on. Okay, what I can tell you is that one of our collaborators in the US, Dr. Daniel Corcus from Northwestern Chicago University, he was attempting to open a franchise using this sort of training for Parkinson's disease patients. So, but
Wow.
as far as I know, there isn't.
I'm sure that if there's not, there will be soon, just because when I read your meta analysis that came out in 2022, I believe, it's powerful, especially when you read how frequent this disease is and how debilitating it is. I think anyone who's been around it is aware that if there is a treatment modality that is effective and low cost and with minimal side effects, I think now's the time in society where we're aware of the side effects of some of these medications that may not even be that effective. So I think, from a philanthropy perspective, it only takes one or two people to create an environment like this where it's just low cost to get in, you're supervised, they monitor you. And I think that is something that in the future, I hope is more prevalent than it is now, and that's kudos to people like you and your whole research group for just demonstrating the effectiveness of these low cost interventions. Um, I'm kind of going to lead the witness here on my next question because you currently have a student who's doing a project that I was a pilot subject for. So now I'm aware that you guys are so far we've discussed exercises that are require endurance and also complex motor demands. But the pilot testing that I did also involved cognitive tasks while performing an endurance task. So could you perhaps give me a rationale for why including cognitive testing into endurance training may or may not be more effective?
Okay, so it's not like a simple hypothesis, but I'll try to make it as simple as possible. So basically, we are trying to test an additive effect. We know that when we perform aerobic exercise, you increase your blood flow, but when you perform cognitive activities, you also improve blood flow. Okay, and that we know that we have already talked about this. This is very important for these individuals. And a problem with Parkinson patients is that they kind of lose. So let me rephrase a little bit. So when we walk, so this form of gait, it's an automatic task for health individuals. So we don't need a
Mm-hmm.
lot of like cognitive control to walk. We may need like cognitive control to start walking, to stop, to turn, but if you're just walking forward, it's a very automatic uh, skill, and mostly controlled at the spinal cord level. But as you age and as Parkinson's disease develops, these individuals, they lose this automatic control of the gait, you
Mm-hmm.
know so they have to use their cognition to kind of control their gait. So they're using an auxiliary mechanism to control their gait so they can perform the gait better. They have like a more constant speed and so on. So the hypothesis here is that when you perform endurance and cognitive tasks at the same time, you're going to improve your blood flow to the brain even more. And then right after the activity, so we name it, it's like an acute effect, you know,
Mm-hmm.
we're going to be able to walk with less variability. That's what happens when you have, no automatic control of this skill, motor skill. So
So that's the
there are
research.
several details. Go ahead. Go ahead.
That's this current project. You're trying to see if the combination of, so you're going to get a baseline gait variability, and you're saying if they're unstable, it's potentially because they're having to use more cognitive components, and you're trying to see if there's an additive effect between improving blood flow and performing cognitive tasks, and if after that it can sort of automate gait more effectively. Is that what this current project is looking
Or we have, yeah, so we can improve automaticity, gait automaticity, or our cognition, our cognitive ability is going to be enhanced. So we're going to be able to control gait better, you know?
Okay.
So that's the point. Because when individuals with Parkinson's disease, as I said, they have like a cognitive decline. So you need to think like this. So they have their automaticity. Okay, this should control their gait. If the automaticity declines, they should use their cognition. But for them, they have both automaticity and cognition decline because of the disease. So we need to find ways to improve that, you know,
And
to improve the cognition, improve gait, and so on. So it's kind of it's a vicious cycle. You just keep getting worsening and worsening and worsening.
And up until now, no one has investigated this additive effect before.
Not not in the way that we are trying to test. You know, they have done like similar things, but not in the way that we are willing to test.
Awesome. And when these results come in, I hope you can come back in here and let us know what the findings say. And if it's promising, hopefully, I'm really envisioning this facility now where it's just a big space that has, treadmills and bikes and walking force plates and a resistance training area. If there's sort of a combined additive area as well, based on the findings of your project, I think that'd be a nice
Yeah,
addition.
well, I would add one area to this facility. So it's just like a large area with foam, different stability device, so they could do several motor activities on this space. That they could develop endurance, they could develop strength, motor control, coordination. So just a very, I would say, enriched exercise environment.
I love it. I have one last main question that I want to touch on, but I worry that it's going to encompass a couple of different factors. So before that, I just want to see if from a mechanistic standpoint, I'm understanding the disease and all of the different ways that you think exercise could play a role. So I may sound ignorant here or not precise. So I'm hoping you can correct me here and make sure if my thinking's correct. So from what you said earlier, Parkinson's disease is affected by, is it both the production and the uptake of dopamine? Is that the case?
Well, I would say mostly production of
Okay.
dopamine. It's not a matter of uptaking, but just the production or the synthesis of dopamine.
Okay. So there's an impairment.
Because we have specific neurons that produce dopamine in the substantia pars compacta. I don't know if I said it correct in English, but that's the structure. It's a brain structure, and basically these neurons that that produce dopamine, they undergo apoptosis, so they are just basically destroyed. So you cannot produce dopamine anymore, and that's why we, Parkinson patients, they take like a dopamine replacement, so a medication to increase dopamine in the brain, so they can function better.
Got it. And so they're impaired in their ability to produce dopamine, and through enhancing
Yeah.
cardiovascular fitness, you can improve blood flow to the brain. Which is that
And
going
okay.
is that going to directly increase dopamine, or is that going to allow the brain to function better in the absence of as much dopamine?
we have this hypothesis. That could be a hypothesis, but we haven't like properly tested. But the main point is that it's not a matter of improving dopamine. So measuring an increased sense of dopamine, it's not that simple. Okay, so that's a problem that we have. But what we can say is that if we start exercising at the early stages of the disease with this increased blood flow to the brain and so on, we maybe can decrease the decline in dopamine
Ah,
synthesis. So
okay.
just to slow down the neurons' death. That's one hypothesis.
Got it. That makes sense. I'm glad we got there. So endurance training, you're hoping the added blood flow can decrease the decline in dopamine, and then from the motor training and the instability training, and then just general force production, is that to sort of maintain and develop sort of the or reduce the further impairments in motor decline, sort of independent again of dopamine?
So that's another question that we don't know the answer. We
Okay.
I would say that there are some suggestions that this sort of exercise may increase dopamine production in other areas of the brain, but this type of exercise may also kind of our brain. It's very flexible, I would say.
Hmm.
So to find different ways to control movement.
Got it.
So that could be an alternative pathway to improve the motor signs.
Awesome. And so, what's already been studied is endurance exercise and motor demanding exercises, and also exercises that require force production and instability. And in the pipeline, you have a combination of endurance exercise with a cognitive task. So, I think if anyone's listening and you know someone who is currently has Parkinson's disease, I think you could take any of those five different modes of exercise and try to find a place where your loved one can be supervised and undergo that. And that sort of blends into the last question I have for you here is during my time at the University of Tampa, there was some research going on with the ketogenic diet. And one of the hypotheses here is that through but either switching a fuel source from glucose to ketones, or even just providing exogenous ketones, it could provide this secondary fuel source to the brain in absence of dopamine and sort of maintain cognitive function. Do you think that if a loved one that you knew was diagnosed, that there's sort of I know the research might not have tested this specifically, but do you think there's a hybrid approach between either exogenous ketones or a full ketogenic diet and these exercise training regimens?
Well, from my understanding, I'm not a specialist in nutrition, but anyway, uh, I think that we need to clarify a few things. So when we talk about ketones,
Hmm.
we are talking about ketones in producing energy for the brain, like glucose. And dopamine, it's a neurotransmitter that has a completely different function in our brains. Okay,
Okay.
so one is the source of energy, and the source of energy. So uh, we need to think that the same way as glucose, if your cardiovascular system is not functioning well, this additional source of energy may not do any good for you. Does that make sense? Because
Yeah.
we need a heart that is able, I'm talking very simple terms, we need a heart that is able to pump the blood to the brain so all the neurons, they can get the appropriate nutrition. That's basically it. So I don't know if adding a ketogenic diet or anything like that would uh, improve the motor signs of this patients. That's my
Hey
guess.
everyone, sorry for interrupting and the abrupt disruption here. Unfortunately, this is where we're going to have to end this first interview with Dr. Ugrinowitsch. We lost internet connection towards the end here, so some of his responses got a little choppy, but most of his thoughts came across throughout the entire episode, and he actually answered this last question here in regards to nutritional approaches for individuals with Parkinson's disease. I hope to have him on again where we can dive into some of these topics a little deeper, and maybe some more experts in the nutritional space as well to complement him alongside that last question we addressed specifically, as well as discuss all other things that we can with Dr. Ugrinowitsch. So I hope you guys enjoyed this episode, and I look forward to seeing you again soon.